Staphylococcus infection can cause more harm than what we all think, and as a matter of fact, Staphylococcus infection is one of the major reasons why a lot of women are not getting pregnant, the major reason why a lot of women are experiencing miscarriage, the major reason why a lot of men are having low sperm count, rashes, painful urination, and so many other conditions like that. But in this video, we're not just going to be talking about what is Staphylococcus, the symptoms of Staphylococcus, but we're also going to be talking about the treatment option for Staphylococcus. So in case you are seeing this first for the first time, please do well to subscribe to my YouTube channel so you can get more amazing videos like this anytime I make an update. Now, Staphylococcus are bacteria that are normally found in the body. They are found in so many areas of your body, including your gut, your genital area, your mouth, your hands, your fingers, your hair. They are found all over your body, but they are called normal flora, which means they are healthy bacteria. But under certain conditions, this bacteria can now start causing an infection to your body, and that's where we're going to be looking at in this particular video. Because you might have been hearing it say Staphylococcus is not a harmful bacteria, it's a normal thing. Yes, it's a normal thing, but when your body state changes, the pH of your body changes, this same normal bacteria can now start causing an infection to your body, and that's why we're going to be looking at the major kinds of infections and places in your body that Staphylococcus can affect before we now discuss how to treat Staphylococcus successfully. Now, let's talk about the major effect of Staphylococcus. And one of the major effects of Staphylococcus to your body is low sperm count for men. If you're a kind of person that is infected by Staphylococcus infection, excessive growth of Staphylococcus, and you don't treat it early as possible, it can start affecting the places where your sperm is being produced, causing inflammation, causing damage and cell death to those particular regions where your sperms are being produced. And in that case, you might have low sperm count as a man. Now, the second effect of Staphylococcus to mostly women is abnormal discharge, itching, rashes around their genital areas. When there's an overgrowth of Staphylococcus around the genital area, it can cause rashes and discharge that is abnormal. Now, it can also make some women to undergo miscarriage. When you are pregnant and you are now infected with excessive growth of Staphylococcus, which means the environmental state of your body or of your vagina or of your genital areas changes, it can give room for an excessive growth of Staphylococcus, and in that case, you might undergo miscarriage when you are pregnant as a woman. The third major effect of Staphylococcus to so many people is eye infection, having conditions like stye, where your eye will be red, inflamed, swollen, painful, and having a kind of discharge. This is mostly caused by an excessive growth of Staphylococcus in your eye. Now, you might also experience painful balls. As a man, you experience some kind of pains under your balls. It's mostly due to Staphylococcus that have not been treated. And mind you, I said Staphylococcus are healthy bacteria, which means God created them to be there to protect and support other activities in your body. But once the environmental state of your body changes, that's when this particular bacteria will start causing problem to your system. Now, you might also experience rashes, itching, cellulitis, folliculitis, which means some rashes might appear on your system due to Staphylococcus. And when we talk about the treatment of Staphylococcus, there are so many mistakes that a lot of people do when treating this particular infection. As a matter of fact, since it's now called a normal or healthy bacteria, a lot of people think it's nothing to be worried about. But there are times where you need to be worried when there's an overgrowth of this particular bacteria in your system. And as I said, there are things that can make you have this particular bacteria. So in as much as you are taking medications to treat it, you need to also focus on that thing that might be promoting the presence and growth of that particular Staphylococcus in your system. It can be either due to temperature, change in pH, and so many factors like that. Now, let's talk about the different medications that are being used in the treatment of Staphylococcus successfully. But before we talk about that, you should understand that there are different strains of Staphylococcus, which means there are different types of Staphylococcus. If we're talking about Staphylococcus aureus, there's also different types of Staphylococcus aureus, and that's why it's always very important you know the kind of Staphylococcus that might be affecting you before you start taking medications for Staphylococcus. And that's why I always advise you meet a doctor so they can test you, know the kind of medications to recommend for you when treating Staphylococcus. Now, there are two different classes of antibacterial medication that are mostly been recommended in terms of treating Staphylococcus aureus. Now, when you are treating Staphylococcus that is methicillin sensitive, one of the medication that you always use is cefazolin. The second one is nafcillin and oxacillin. Now, the second class of medication you're going to be using for this particular type of Staphylococcus aureus, which are methicillin-resistant Staphylococcus aureus, includes number 1, daptomycin, very effective in terms of treating Staphylococcus aureus that are methicillin sensitive. The second one is vancomycin, the third one linezolid, and the fourth one clindamycin. These medications are very effective in terms of treating Staphylococcus aureus that are methicillin sensitive. So when treating Staphylococcus, you need to know the ones you're treating. If you are treating Staphylococcus aureus, make sure it's either methicillin resistant or methicillin sensitive Staphylococcus aureus you are treating, so you can know the particular medication you'll be taking for that particular Staphylococcus you are treating. So after watching all of this video, if you find it very helpful, please do well to subscribe to my YouTube channel so you can be getting more amazing videos like this. And if you have questions you want to ask about this particular topic, Staphylococcus, or other topics about your health, please do well to drop it in the comment section and I'll be right there to respond to you as soon as possible. Thank you for watching this video. I'll see you next time.